What's happening, gang? Welcome to Hill. I'm just playing. I'm just playing. We're doing reaction videos again today, but welcome to our YouTube channel.
Welcome
You
to
can play like
channel.
mellow music just to mellow me out from that dramatic moment there. Yeah, we'll be watching some TikToks from Tom
Yeah, from Tom.
and Luto.
This is Craig.
I'm Craig.
I'm surprised.
Welcome,
Yeah, we're reacting to videos about teeth.
because
Wow.
we're dentists.
Mm-hmm.
We know a lot about teeth.
Yeah, we studied teeth. That's cool.
Mm.
Let's play.
This is called baby bottle syndrome. Occurs when a toddler sleeps with a bottle or sippy cup filled with milk, juice, or sugary liquids. The top 4 teeth need to be removed.
True story.
Yeah, I don't know how to react to education. That was informative.
Explained
That's
everything.
my reaction.
Yeah, it's
Informative. Accurate.
That's true.
Did they lie? No.
If I had a cap, I'd say take it off and say no cap.
Yeah. But yeah, so that's
Baby bottle carries, right? That's what they call it.
yeah.
So,
Or lazy parenting syndrome. I'm kidding. I'm kidding.
so I've never had a baby. Have you had a baby?
Huh?
Have you had a baby? Like, no, have you taken care of a baby?
Taking off a baby. Like you don't have to tell everybody I'm a deadbeat. Like
Hey,
you don't do that. I'm kidding. I don't have any children. I'm not a deadbeat. No.
So,
No.
but I know kids are hard to manage and kids need to sleep because you need to work
And you need to,
to pay for the bills for the
Exactly.
kids. So what makes kids sleep is sugar. So parents sometimes, let the baby sleep, with like juice in the baby bottle or give them tea with some sugar. But what you're doing is you're letting the bacteria work over time. So now that's how you get those types of cavities over there.
Mm-hmm.
So once the teeth reach that type of level, there's not much you can do. Not much you can do.
How much you can do?
Yeah, you just have to extract and then just hope that the permanent teeth come out nicely,
Mhm.
And if there's misalignment, you correct. But moral of the story, don't let babies sleep with sugary drinks.
Yeah, just put a dummy in there. I mean, as long as it's something to suck on, if you want to keep them quiet. But basically, if you wouldn't do it as an adult, like you wouldn't like grab your Coke or your Savannah and just like in bed to fall asleep. You would drink it and then go to bed. So I don't know how to put a baby to sleep.
Yeah. So you know what? This is the first
Maybe.
time we should do this. Comment underneath.
Oh, yeah.
Below.
Mothers, tell us how you
and
and fathers,
yeah, how do you guys put your
present dads, you know that video.
yeah
Yeah. Tell us how you put your babies to sleep.
without sugar, and also make
Or
sure
violence. You know what they did to me once?
What?
Liquor. They would give me some liquor.
R18. We just got rated 18.
Really?
Yeah, liquor.
You can't say liquor on YouTube?
No, you can.
Oh. Okay. Well, yeah.
Tartar alert. OMG. Chip away at it. How long will it take? How many teeth are hidden?
Okay.
I was sure that Tom, damn, well, at least show us the clean one, like what it looks like after it's clean.
But shout out.
But shout out, you probably like would have lost like a kilogram after that cleaning.
Mm,
Weight loss journey.
mm.
Yeah. Well, that's a lot of plug. It's easy to judge some of these people, but other people just attract more plug than others, and that's why that happens. And haven't seen a dentist, and maybe don't even have access to a dentist, because who would like just let this happen to their teeth? So I don't think it's always negligence, because people wouldn't want this to happen to them. So yeah.
Yeah, I watched the video once where there was like extreme like plug buildup on YouTube. And the lady was like scared of like dentists and stuff. So some people have deep dental phobia. So yeah, just going for a normal cleaning can be scary. And this is in countries with lots of money. She did the cleaning under conscious sedation. So yeah, some
Oh,
people,
that's like a 7,000 rands cleaning.
yep, it is. Some people really have like deep dental phobia.
Mm.
So if you've got that, and you accumulate plaque quickly, and it can get there. It can.
Yeah.
I'm not saying it should get there. If you don't have 7,000 rands to pay for cleanings, just find a way. See a psychologist, a therapist.
Cheaper than conscious sedation.
Yeah, cheaper than conscious sedation. They will help you deal with this because this is dental phobia and years of not going to the dentist.
Yeah. And if like it's really, really bad, you can clean in sections. You don't have to like do the whole thing at once. Like baby steps, like we'll do one part of your teeth, then another, then another, then another. If you have a family member or a friend who probably has something like this is basically like just dead bacteria and dirt and food debris all piled up and it hardens. I don't know, share a dental reel with them.
Indeed.
Yeah,
Share this with them.
share this with them.
Severe decay leads to silver caps on baby teeth. My little friend has silver crowns on all top 10 due to baby bottle decay.
Shout out.
It's Gucci. Yeah, man, those are cool.
Those are cool.
Those are cool.
That would be that's cool. Like imagine like rocking up at school.
With
you know,
those, yeah.
And like Offset. Oh man, jeez.
Mhm.
Like yeah.
But they don't. So like, luckily, they're gonna come out as they grow. So you can. I think babies can totally get away with that. A little swag for 2 years. But I don't know what type of psychological issues it might form for them in the future. Like, hey, Angela, kid with all silver teeth. But still cool.
And the reason why we do silver crowns, babies, we can't do like our normal conventional crowns, right? They're too small, and you can't take impressions. Like kids are not.
Rigidity,
Yeah, too
saliva,
rigidity,
yeah.
it's too much. So we have like a prefabricated crowns, right? You can get these, and they are all silver, right? And also they're silver because they're temporary. They're gonna fall out. So you don't have to do much. All you do is just put them in and you stick them in. So it's quick for working with kids, because if you work in theater, you only have an hour or an hour and a half, and that's all you have. You have nothing more. So you can't say, oh, we'll do this on the second day. You need to work like very quickly while the baby is sedated. So you need something quick, like silver crowns.
Was probably left with a bottle in his mouth.
Yes, it was. It's from baby bottle. So you see, if you put your baby with no parenting advice, not giving parenting advice.
Yeah, because we'll probably be bad parents. But yeah.
You'd be a great dad. Got hooked quick.
Yeah, okay. Yeah.
But yeah, don't put babies to sleep with bottles.
Yeah, just a dummy.
Let's see.
Come check this.
What is that? What is that? Isn't that like a retainer?
Looks like a retainer.
Yeah, looks like a retainer.
Yeah.
Yeah.
Oh, okay. So like our patients always ask us after they remove their braces what type of retainer they should get, like a permanent one or a removable one. And they all work the same, but gotta 6-7. You gotta you gotta choose which one will work better for you. For people with permanent retainers, you always have to make sure that area is clean, brush it a lot, because it will retain a lot of plaque, and it's not cute. It smells funny.
Yeah.
Yeah.
Every treatment has its pros and cons. There's no treatment that's perfect. So if you get a fixed retainer, the downside is hygiene. And people who remove fixed retainers after many years always complain that it's so difficult to keep it clean. So if you want a fixed retainer, just know if your oral hygiene is like 60%, you're gonna have to take it up to like 80, because you have to like run the floss through there. It's not an easy thing. So yeah, so that's probably the fixed retainer that has accumulated plaque and looks like that. So yeah, now you know why sometimes we say, don't get a fixed retainer, maybe get a removable, because the removable seems like work, but it's easier to maintain cleanliness, which is next to godliness. Next,
Is that like in the scripture? Is that something people came up with?
I think something people came up with. Yeah.
بجد بعزم فصيح فإني علمت بأنك نجوى ولبس خبيث مضل قبيح تبختر ترجل بصوت وخيل فما لك في الأرض درب صحيح إلى الله عدنا وبالله نذنا ليطوى زمان بائس شحيح ليطوى زمان
That's good.
It's beautiful.
That's beautiful. Shout out.
Yeah.
Shout out. They're great dental work. Love to see it. Love to see it.
Yeah, so that person had a root canal. And if you've had one before, we usually tell you like, hey, you should probably put a crown on it afterwards so that it doesn't break. Because a root canal is expensive. For it to go to waste after just a few years, it's a lot. So just put a crown on it just to reinforce it. But this person probably didn't, and it fractured. And so they did like something we call a post and core. So you remove like a piece of the root canal treatment and add like a post to just reinforce the strength of the tooth. And then they just built around it there. I don't do this at all here. He does that. So he probably has more
Yeah.
nuggets to share.
Yeah. There's an interesting one that hopefully we can post. We're delivering it on Saturday. But yeah, so it happens a lot. Car accidents, people who are susceptible to cavities, fractures of teeth happens a lot. So to strengthen the teeth, because if you put a crown here, it's not going to work. Where are you going to put the crown? There's no space to put the crown. There's no space. So you have to create something. But you can't just stick it on the top. You have to go into the tooth and use that as reinforcement. It's like a pillar. Is it a pillar? Yeah, it's like a pillar. Like you put a pillar into a tooth and then now you've got like a fun pillow of string. Now you've got something to work with. But this guy here didn't use a crown. They built it up with composite and they made it look very nice. Shout out. That is very beautiful.
Good song selection.
I assume it's the same thing as the previous one. You're probably wondering what that string is. That is called a retraction cord. So when your gum, there's a space between your tooth and your gum. So when you're working, you want to push the gums away because the gums have water and stuff, and our materials don't like water. So you push this thread into the tooth and it stops the bleeding, stops the saliva which is in your gum from touching the material. Yeah, so that's that string. They used it in that previous video as well. So it's not a worm. I once saw something on Twitter where people were like, what is that thing? They thought that was like an infection or something. It's called a retraction cord. So
I was wondering why you said it's not a worm.
yeah, so a lot of people say, oh, is that a worm? It's not a worm, it's a cord. And we use it as well for crowns. So we need to capture the margin, the edge of the crown. So you use a retraction cord.
I did that's all, folks. We have reacted to this wonderful, amazing videos that were very educational. Yeah, less jokes than last week. So, and can we have so many dental jokes, right?
You know what? If, for example, you see an interesting video, maybe send it to us. Tom will find it and maybe we can react to it because there's probably something you see on the internet because our algorithms are different.
I almost have no dentistry in my algorithm.
Really?
Almost.
Wow. Yeah, fine. So we all have different algorithms. So you might see something that we don't see. So if you do share it and then we can respond, react, and give you feedback, Yeah. And that's it for today.
Are those selfies? Can react to Tom's selfie.
Oh, he looks good.
It does.
Oh wow,
I'm
strong.
feeling myself.
Look at that.